Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department for the second week in a row, again maskless, because all the folks in here have been vaccinated and are beyond the 2-week period. We were delighted today to have Governor Wolf in town, and it was great to see the governor, who's obviously made a big announcement, the state did yesterday, regarding continued expansion. And the governor made the announcement a week or so ago that at the end of May, just a few weeks away, all the mitigating strategies, all the the limitations, I should say, will be going away, other than the mask mandate. The news continues to get better and better, and Dr. Bogan will go into some of the things that are happening. As we approach, almost 70% of our adult population has had at least one shot in their arm. And almost 50% of the adult population has had 2 shots in their arm. So we're doing much better than other parts of the state, and quite frankly other parts of the country. But we want to get that last 30% of folks vaccinated. We know the CDC today, the committee recommended, along with the FDA, which did a couple of days ago, that now 12-year-olds and above will be eligible. So, we'll be able to get all of our high school students and many of our middle school students as well. And I know many school districts are already making their plans for next week and getting supply and getting shots in arms for that population as well. And we just want to get healthier and healthier. And earlier today, again, with the governor in town, we were able to kind of compare what's going on, and quite frankly, what we have done in our history. And I want to thank not only Dr. Bogan and Secretary Levine and all the medical experts, but when we go back to the last pandemic of over 100 years ago, we did not listen to our health professionals. In fact, our health professionals were making solid recommendations which were overruled by special business interests that wanted to keep everything open. The results of that were Pittsburgh at the time led the nation in the amount of people who died during the Spanish flu pandemic. In fact, 1% of our population during that pandemic perished. And that was literally over like a 6-month period. Now we certainly are very sad the fact that over this 14-month period, over 1,900 of our fellow Allegheny County residents have passed away. But at 1%, we would have been over 12,000 of our fellow Allegheny County residents would have passed away. So the fact that we have listened and taken the good sound advice that we have seen out of the Secretary of Health at the Pennsylvania level and at the local level with Dr. Bogan and all the folks from University of Pittsburgh Medical School, AHN, UPMC, giving us good advice. We want to continue along those lines. And again, they're advising to get vaccinated, and we want to do that. So with this week's update, which continues to move in a good positive direction, we turn it over to Dr. Bogan. Dr. Bogan?
Thank you, County Executive. Hello, happy Wednesday, everybody, and welcome. Today, I start with encouraging news. Our daily average of new cases dropped again to around 170 cases a week. I use the word encouraging because while we certainly can, and I hope will, further lower our daily case counts, we haven't seen daily numbers consistently under 200 since October of 2020. So it's great to be at about 170 a day, and the numbers will go down even further if we can get more people vaccinated. As for updated vaccination rates, our Allegheny County numbers are also encouraging. Among people 65 and older, more than 96% are fully or partially vaccinated. For people 50 to 64 and 35 to 49, the rates are 83 and 62% respectively. We still have quite a bit of work to do with our younger people. Just over 51% of those 20 to 35 and 27% of eligible teenagers, meaning 16 to 19, are vaccinated. And with the Pfizer vaccine close to gaining approval any moment for children as young as 12, we will have an even greater ability to protect our community from COVID-19. So again, I urge you to go out and get your vaccine today. And if you have hesitant friends or family, kindly remind them that vaccine confidence, not hesitancy, will save lives and move us closer to our old ways of life. Now, with Governor Wolf's announcement that he will increase indoor and outdoor gathering sizes on Monday and lift all mitigation orders except for the mask mandates starting on Memorial Day, we here in Allegheny County and all of Pennsylvania are moving into a new phase of the pandemic. With the approach of this new phase, I had cause to reflect on what I see as the 5 previous phases of the pandemic. I do so because, as with other phases, we don't know for sure what's to come. Each phase requires a different response, and we must learn and make decisions even with limited knowledge. So I look back in hopes that our recent history might provide us valuable guidance into the future, as it typically does. The first phase, which began in March 2020, held so much uncertainty. We did not know how best to treat the disease, how the virus spread, who was most at risk, and so on. We didn't have enough personal protective equipment or testing capacity. During this time, it was critical that we worked effectively with other organizations to share information and resources as they became available. That was the most important lesson from the initial phase, the value of working collectively to share clear, transparent data and information. We were all learning on the fly, but we learned quickly, I believe, because we worked together. In the second phase, as we reopened in the early summer, we had a surge in cases related to travel and social gatherings. This required different mitigation strategies, including mandatory mask wearing and, unfortunately, the reclosure of bars, restaurants, and other businesses. The third phase in early autumn was characterized by promising developments. We saw emerging options for COVID-19 medical treatments, vaccine trials began, testing capacity increased, more and more people were wearing masks, and we had a brief respite in cases locally. This was the phase during which we began to see the elusive light at the end of the tunnel, even if it appeared only as a tiny dot at the end of darkness. That third phase also gave us the time to plan for the future by developing online case investigation forms, improving messaging and outreach, and advancing medical treatment. This preparation was critical when the fourth phase hit in the late fall and early winter. In that fourth phase, we experienced our largest surge in cases, hospitalizations, and deaths. And it came at the worst time, the holiday season. We all wanted to gather with friends and family to surround ourselves with hope, love, and happiness, but we simply had to do it differently last year, and that made messaging from the health department and government leaders especially important. We are in the fifth phase currently, the vaccine phase. We now have 3 vaccines that are proven to protect people from COVID-19. Every adult is free to get vaccinated, and children as young as 12 should be any moment eligible for the Pfizer vaccine. Certainly, this phase has brought its own challenges, but it has also shown us how important it is to work together while addressing the logistics of mass vaccination. At first, the task was fairly straightforward. Outreach to the most at risk, in this case, our seniors. The focus was on long-term care, senior living facilities, senior centers. We and other vaccine providers also opened mass vaccination sites to provide doses to specific populations according to the state eligibility criteria. Supply now exceeds demand, so we and others are shifting gears to bring the vaccines to smaller groups who may include people who are unsure about getting the vaccine. Messaging continues to play an important role as we strive to emphasize vaccine confidence. Now we're about to enter a new phase, and I wish I had a crystal ball to tell everyone exactly what will happen starting May 31st with the lifting of mitigation orders. Of course, I don't. But I do have our shared knowledge from the first 14 months of this pandemic, and that knowledge tells us that we are best when we work together. We can all do our part to make phase 6 work for us. If we all get vaccinated, if we continually socially distance when appropriate, to wear a mask for the protection of others, to be considerate of others, and smart in how we reopen the state. We can do this together. Will there be setbacks? Perhaps. All the more reason for us to work together. Let's not merely dream about returning to normalcy. Let's make it reality. Step 1, of course, is getting everyone vaccinated. So if you haven't done so, please go get yours today. Thank you, be safe, and be kind.
Our first question today is from WPXI. With kids in the 12 to 15 age range getting vaccinated, will there be any new guidance for schools in the county when it comes to social distancing, mask wearing, or other measures?
So as I've answered that similar questions in the past, the Department of Health doesn't really provide the guidance. It's really the State Department of Health and the State Department of Education that provides school guidance. And so I'll leave it to you to ask them for that, any changes that will be made according to that.
This next question is from WTAE. Does the Health Department have any thoughts on how the administration of the Pfizer COVID-19 vaccine to children ages 12 to 15 might be handled? What will parents be required to do and bring with them to make sure that their children are vaccinated?
You know, we've been vaccinating children in our community, not just for COVID, but for many, many vaccines for a long time. And this is really no different. Those vaccines require parental consent with some minor exceptions. And so this will require parental consent, and each organization that provides vaccines will have guidance on how that's done. Most likely an online consent process. Most vaccines are being done that way. But you know, this is really just routine for pediatricians, family physicians, our health department, and all of the health providers around. And it will be done the same way it's done for all vaccines.
And this question from the Post-Gazette, will the health department's points of dispensing be vaccinating children in the 12 to 15 age group?
So don't forget, only the Pfizer vaccine is being used for those under 18. So at our sites that have Pfizer vaccine, we will absolutely be providing it to anyone who's age eligible to receive it.
This next question is from the Tribune Review. With daily cases dropping, do you think that we are at the end or close to the end of the fourth wave?
So as I said, I think the numbers are very encouraging, but we're still well over, you know, we're still in the hundreds of cases a day, and so we're not out of the woods. We'll be out of the woods when we really get the vast majority of the people in our community vaccinated. So I'm optimistic, but I make no promises.
This next question is from WPXI. Can you weigh in on the children who were mistakenly vaccinated at a vaccination clinic yesterday, even though the FDA has deemed the vaccine safe? Are there concerns that these kids were able to somehow get vaccinated?
You know, I think that people were excited to have families who wanted to get the vaccine. They jumped the gun a bit, but again, in some states, they're already vaccinating this age group. And so again, no, I don't think any harm was done. I think it was just an exuberance to start vaccinating this age group.
This next question is from WTAE. Could you speak to how the county is preparing for the increased indoor and outdoor gathering limits on Monday?
Yeah, we're going to be following the governor's guidelines on where they are on following the mitigation practices. You know, the county has been, you know, working, Dr. Bogan and her team have been working with the state, and our other organizations have been doing similar type things. So it's good news, but we want to make sure people do follow the guidelines. Don't go too far. Don't go beyond what's going to be coming out. And as Dr. Bogan said, you know, things over these various phases and various cycles have happened, various waves. Things do change, and people just have to continue to, you know, follow the information that's going to be put out there, that we put on our website, that goes on Allegheny Alerts and other such events.
Thank you. This next question is from the Tribune Review. Can you provide any update on the number of variants and which variants have been identified in the county?
So the variant information we get actually comes from the state. The state lab sends much of it to the CDC. And so I actually think the best source of information for the variants is actually the CDC website that has a whole section devoted to the variants, and it reports it by state. And it gives the total number of variant cases identified in the state, not by county. And again, some of that is because of how samples are selected to be tested for the variants. So I don't have any except to say that I know that we continue to get reports of positive cases, again, mostly of the UK variant here, and some small number from other variants as well.
This next question is from WTAE, and even though you've referenced it before, it might be an opportunity just to remind people of your recommendations. Some pharmacies are now offering walk-in vaccine appointments, indicating vaccine supply has caught up with demand. What would your message be to anyone who is still hesitant to get vaccinated?
Oh, we have literally vaccinated in our country, I don't know, over 30 million people, I think it is. Maybe 40 million by now. I think the data are clear that these are remarkably both effective and safe vaccines. Last week I spent a lot of time talking about the myths and the truths about the vaccine. I have incredible confidence in these vaccines. I personally have been vaccinated. All of my family has been vaccinated. Again, if I didn't truly believe these were safe, I wouldn't recommend my loved ones be vaccinated. But it is, and our cases are evidence of the declining numbers of cases we're seeing. The rare, the deaths that we're still seeing are among those who are not vaccinated. And so, again, we need to talk about vaccine confidence. We have enough experience to say that these vaccines are safe with absolute confidence.
This next question is from the Tribune Review. Will the county update its own vaccine strategy at all now that the Pfizer vaccine has been authorized for adolescents as young as 12 to reach those individuals?
I'm going to remind you that the county health department, again, does a small part of the vaccinating in this county, that we have lots and lots of people who are vaccinating those. So the strategy you're talking about across the county, our vaccine providers all do get on a call together every week, and we're all talking about going to smaller events, to reaching all of the populations in need. But really, the strategy is not changing from the health department. We talked about last week is going to smaller events, into the community, working with community partners. But I can't speak to the strategy of the entire county because I don't control all of the vaccines. But that being said, we are, I think most providers are really working to do smaller events and to reach out to higher risk communities.
And this final question is also from the Tribune Review. What do you think of many colleges, including some local institutions, requiring students to have COVID vaccinations for the fall?
Yeah, I very much support Carnegie Mellon making the decision that they're going to require vaccinations for their student body. I think over 360 colleges and universities around the country have done the same thing. And I think you're going to see more and more of that. I think those folks who don't get vaccinated it's going to be very difficult. They're going to have to quarantine when they travel. They may not be invited to certain events, meetings, etc. So I just think it's going to be, while all these mandates from the government may not be the case, I think it's just going to be very difficult for individuals to operate through many functions of society if they refuse to follow the science. We know, as Dr. Bogan said, these vaccines are safe, they're effective, and they work. And the fact is, we're in a meeting today in an event with a number of people. We've all been vaccinated beyond 2 weeks, so we could take our masks off and operate the way we did pre-pandemic. And the only way to do that is for us to get everybody vaccinated. And the fact is, now we're down to the 12-year-olds. Hopefully, as science moves on and experimentation and the trials go on, that we'll be getting even younger and younger folks vaccinated. So we're in a much better place than certainly we were just a few months ago. We want to continue to make sure as many people get vaccinated. If you've got some hesitance here, you've got some information you need, we can certainly provide it, as well as our other healthcare professionals. But again, we have followed the advice of very sound, good healthcare professionals that we're so fortunate to have in this region that has developed over the last number of decades. And it's one of the reasons I think we've done as well as we can in a very difficult situation, and certainly better than a lot of other places around the country. So anyway, we'll be back later on. Everybody stay safe, get vaccinated if you haven't been, and let's continue to move forward. Thank you.